very small changes during surgery can make a massive difference to the outcome of the procedure. So All-on-4 or All-on-X is probably the most complex dental procedure that anyone can have. It carries risks involved, and let's just talk about the 6 risks that are possible. So the first is that it is permanent and irreversible, which means that when we do this treatment, there's no turning back. We're literally going to be either having a patient that has no teeth and we're placing in some implants to put in a new set of fixed teeth, or we're removing all the natural teeth, usually because of gum disease or decay or breakdown, and then we're placing implants. So there's no way of going back once we have started doing this treatment. The second is that there is a risk of implants failing. And there's 2 types of risk we see. We see that worldwide there's a 3 to 5% risk of implants not taking within the first 3 to 4 months. A lot of the times we don't know why this happens. Of course, there's an increased risk with those people that are actually medically compromised. So we're talking about patients that have type 1 or 2 diabetics, people that smoke, of course, if they're grinding or clenching heavily. And in these patients, because of the force or their health, they're actually getting a higher risk of failure, sometimes up to 20%. This is very important to discuss with patients because some of these risks are avoidable risks, which means that if you're smoking, for example, and you quit, you can really reduce the risk of your implants failing by around about 4 to 5 times. And if that's possible, we always want to discuss this with the patient before we even commence treatment. From our point of view, to mitigate this, as long as the patients understand the risk, and if we do get a failure, we will know this failure within the first 3 to 4 months. And in that period of time, we haven't got that much infection or any bone loss. So for us to replace the implant is quite simple. The risk is if someone, for example, gets the treatment done and then has a failed implant and leaves it for a period of 6 months to 12 months, usually not only does that implant fail, which means you get bone loss and infection from that implant, but that failure then cascades through all the implants and you end up losing all of the implants, all of the bone, and there's no way of actually going back and doing treatment again. So one of the things that has come about, especially for those patients that were considering going overseas for treatment, is that their maintenance visits were not done. So if you are not getting your implants checked in the first 3 to 4 months, you're not getting it checked every 6 months after that, your chance of implant failure is very high, and maintenance is always going to be a problem. So the third risk is that it is complicated surgery and things can go wrong. And no matter how much planning you do in order to try and mitigate the risk or make the risk as low as possible, it is the experience of the surgeon and the team that allow these cases to actually go through. And very small things, very small changes during surgery can make a massive difference to the outcome of the procedure. So the fourth risk we need to talk about is bridge longevity. Okay, when we do dental implants, there's 2 components that we talk about. We talk about the implants that are actually inside the bone, and as long as the patient's healthy and the gums are healthy, these implants can last the patient the rest of their life. But the other part of it is that we also have bridges, and the bridges are what does all the work. They're in the mouth, there's temperature, bacteria, chewing function and grinding. We know that these bridges, depending on their material, can last anywhere 5 to 10 years. So it's really important for patients to know up front what is the ongoing cost of not only the bridges, but ongoing maintenance to ensure that the implants are kept healthy and that they get the best appearance and bite from their teeth. The fifth risk kind of follows on from the other one, and this is ongoing maintenance of the teeth and the implants. It's really important to remember that this is not a one-off procedure. I would say it's very similar to buying a car. You're not going to buy a car and not take it in to get serviced at all in its whole life because you know it's going to give problems. When it comes to dental implants, it's important to remember that you need to come in every 6 months for maintenance. And there's 2 maintenance that we look at. One is a minor maintenance where we just do a normal clean. The bridges are actually kept in the mouth and we'll basically clean around the bridges and the teeth and the implants. And then every 2 years we take the bridges off and actually tighten the abutments and ensure that the screws and the fixtures and the abutments are all fine. Bite is super important because if the bite is actually uneven, it will cause problems with the implants and the bridges. If the bridges are not made correctly or the implants aren't placed in the right position, we will find that the bridges are too thick and patients will then have problems being able to pronounce certain words. And this is super important because when we are doing full replacement, we already know that there's no turning back, but this is something that's very permanent. So not only is there a lot of planning that goes into the smile design, and also how the bite and the function is, but we really have to make sure that you don't rush into having treatment because we have to engineer this very carefully. And they kind of go hand in hand. For example, we always talk to patients about how the teeth look, and we can always manage cosmetics so they're beautiful. So we don't want patients to feel overwhelmed, but if you have any questions or need any answers about our clinic or full teeth replacement, we're always here.